Welcome to the deep dive. Today, our mission is to unpack a rapidly growing, but I'd say rarely discussed trend in cosmetic gynecology, and that is the labial puff treatment.
Yeah, it's a topic that's really gaining traction right now.
It really is. And to figure out what this actually is, why women are seeking it out and the biological mechanics behind it all, we have pulled together a pretty revealing stack of sources for you today.
Right, we've got medical brochures from some top-tier aesthetic clinics across London, Manchester, and Dubai.
Plus, we're looking at official NHS commissioning guidelines, some insights from the British Association of Aesthetic Plastic Surgeons, or BAPS.
And, crucially, a very sobering investigative report from The Telegraph.
Yes, detailing the severe dangers of the unregulated backstreet aesthetics boom, which we'll definitely get into later.
Because the contrast within these sources is just stark. You have this glossy, high-end marketing, promising intimate rejuvenation on one side, and then the stark medical realities on the other.
Right, the reality of altering highly complex human anatomy, which usually when we examine the anti-aging industry, there's a very specific map that comes to mind.
Sure, the face.
Exactly. It starts at the forehead, works its way down to the crow's feet, maybe hits the nasolabial folds, and then stops firmly around the jawline or the neck.
The public-facing territory.
Right. But today, we are going completely off that map because the exact same aesthetic principles, the plumping, the filling, the volume restoration, they are quietly but massively migrating south.
Yeah, they're being applied to the most intimate, hidden areas of the body, which represents a major pivot in the aesthetics industry.
It really does.
We're looking at procedures designed specifically to alter female genitalia, but utilizing formulations and techniques that were entirely pioneered for, facial reconstruction.
Right, facial cosmetic enhancement. So to really understand what a labial puff treatment is, we have to strip away the marketing jargon. Let's start with a baseline of what is actually being altered here.
That's important, yeah.
So the external female genitalia, the vulva, primarily features two sets of lips. You have the labia minora, which are the inner folds, and the labia majora, the outer folds.
And traditionally, the most famous cosmetic procedure here has been the labiaplasty.
Right.
Which targets those inner folds using reductive surgical techniques, like literally cutting away excess tissue.
Trimming it down.
Exactly. But the labial puff is the exact inverse of that procedure. It strictly targets the outer folds, the labia majora. And rather than subtracting tissue, it is entirely about addition.
It's all about restoring lost volume to those outer layers.
Right.
So if the goal is volume restoration, we really have to look at the biological mechanism causing that volume loss in the first place.
Yeah, the why behind the deflation.
Exactly. I tend to think of the labia majora acting almost like a biological protective scaffolding. But what's happening at a cellular level that causes this scaffolding to collapse over time?
Well, the primary driver is hormonal. Specifically, it's that sudden drop in estrogen during menopause. Because vulvovaginal tissue is packed with estrogen receptors. Estrogen is the hormone responsible for signaling the body to produce collagen and hyaluronic acid.
Which is what keeps everything plump.
Right. It keeps the tissue elastic, thick, and hydrated. So when estrogen levels plummet, that signaling just stops. The structural scaffolding of the tissue literally breaks down.
You just can't hold on to moisture anymore.
Exactly. It loses its ability to retain water. Think of a thick, hydrated sponge where the internal architectural fibers suddenly snap. It doesn't just dry out.
The whole thing collapses.
Yeah, the entire structure collapses and thins out.
Wow. And alongside that hormonal shift, the clinic notes we reviewed highlight mechanical and lifestyle factors too.
Absolutely.
Like the physical trauma of childbirth causes immense stretching and tearing of those foundational tissues.
Sure.
And significant weight loss plays a massive role as well. Because when you burn significant body fat, you can't dictate where it comes from, right?
You really can't spot reduce or spot retain fat.
Exactly. So the localized fat pads within the labia majora can become entirely depleted, leaving the overlying skin sagging and deflated.
And, the biological realities of aging and tissue atrophy, those are universal. But what our sources reveal is a very modern cultural catalyst that's just amplifying the demand for this specific intervention.
Yeah, the notes from Moorgate Andrology are fascinating on this front.
Sure.
They point to widespread behavioral shifts. Primarily the normalization of removing pubic hair.
Right.
Whether that's through waxing or laser hair removal, stripping away that natural visual barrier leaves the anatomy entirely exposed.
So women are suddenly scrutinizing an area of their bodies that historically might have been mostly obscured.
Exactly. And that visual exposure is compounded by the media landscape. The Moorgate source specifically mentions the mainstream accessibility of pornography.
Which almost exclusively presents a highly curated, often surgically altered image of female anatomy as like the default standard.
It sets an impossible baseline.
Yes.
And then you add to that our daily wardrobe choices.
Oh, the activewear.
Yes. The sheer popularity of tight-fitting activewear, the fact that a huge portion of the population essentially lives in yoga pants and leggings now, it has made women hyper-aware of the contour and shape of this area.
Yeah, the clinical notes from Dr. Reza Nassab over in Manchester even use colloquial phrasing to describe this aesthetic pressure patients feel.
Right, the innie versus outie debate.
Yes. He notes a cultural preference shifting aggressively toward an innie appearance, where the plump outer lips act as a clamshell to completely conceal the inner anatomy.
As opposed to an outie.
Exactly. And when you combine the biological thinning of the tissue with the psychological pressure of these hyper-curated aesthetic standards, well, you get a massive surge in demand for clinical interventions.
Right, which brings up a critical question for anyone listening who might be considering this. If the biological scaffolding collapses, causing a loss of that protective cushion, is the surge in this procedure truly about treating physical pain? Or is it overwhelmingly driven by fashion trends and social media insecurities?
I mean, you can't entirely separate the two drivers. The functional loss of that cushion causes genuine, severe physical issues.
Like chafing.
Exactly. When the labia majora thins out, women experience intense friction against their clothing. Activities like cycling or horseback riding become excruciating.
Wow.
The thinning tissue is also far more prone to micro-tears, chronic irritation, and painful intercourse. So the physical discomfort is undeniable and definitely requires treatment.
But the clinics, however, they lean heavily into the rejuvenation marketing side of things.
Oh, for sure.
They're really tapping into the psychological boost of feeling confident in swimwear, addressing the insecurity directly alongside the physical pain.
Right.
So if a patient decides they need to rebuild this collapsed scaffolding, what materials are actually capable of surviving in an area subjected to that much daily friction and pressure?
Well, the clinical brochures outline two distinct methodologies, depending on the material used. You've got synthetic, lab-created gels on one hand, or the patient's own natural tissue on the other.
Let's examine the non-surgical route first. The clinics rely on hyaluronic acid, or HA fillers.
Yeah, that's the standard.
And we're seeing specific brand names pushing the brochures, right? Like Deserial, Novia Intense Rose, and Revenus Versa Plus Air.
Right, and these are basically the same foundational sugar molecules used to plump lips and contour cheekbones. They're capable of holding up to 1,000 times their weight in water.
But you can't just take a standard facial filler and inject it into the vulva, can you?
No, not at all. The formulations have to be heavily tweaked to withstand the specific biomechanics of the pelvic region.
Right, because the Deserial brochure points out a key chemical addition. Mannitol.
Yes, mannitol.
Which is an antioxidant. Why is an antioxidant critical for a filler injected into this specific area?
It really comes down to how the immune system reacts to trauma. So when a needle pierces tissue to deposit a synthetic gel, it triggers a localized inflammatory response.
The body knows something foreign is in there.
Exactly. And it immediately floods the area with free radicals, which are essentially these molecular scavengers designed to break down foreign substances. If you just inject pure hyaluronic acid down there, those free radicals will metabolize and destroy the gel very quickly.
So it basically eats the filler before it can even do its job.
Precisely. So mannitol is added to act as a sacrificial shield. It neutralizes the free radicals, protecting the hyaluronic acid from degradation.
Oh, that's clever.
Yeah, and this specialized formulation is what allows those volumizing and hydrating effects to endure in such a high-friction environment.
Endurance is kind of a relative term here, though.
That's true.
Looking at the logistics, this is marketed as a quick, quote-unquote, lunchtime procedure, taking maybe 20 to 30 minutes under local anesthetic. But the cost ranges from $375 to £1,200 per treatment.
And it's not permanent.
Right, because the body eventually safely metabolizes both the mannitol and the HA. The results only last between 6 to 18 months.
Yeah.
That is a significant recurring financial commitment for you to make.
Which naturally drives patients toward the second option outlined in our sources, and that is autologous fat transfer.
It's a surgical route.
Right. This is the surgical, theoretically permanent alternative.
The mechanics of this are far more invasive, though. Instead of a pre-filled syringe, the surgeon performs microliposuction usually on the patient's inner thighs or abdomen.
They harvest the fat, purify it in a centrifuge to isolate the healthiest cells, and then graft that fat into the labia majora.
And because it combines liposuction with grafting, the entry price jumps significantly. We're talking starting around 2,500 pounds.
But the appeal, despite the cost and the fact that it's surgery, is the longevity. You know, the brochures from the Center for Surgery and the Cadogan Clinic, they heavily market this method as a permanent solution.
Yeah, and I found myself really scrutinizing that specific marketing claim.
How so?
Well, human metabolism is in a constant state of flux, right?
Right.
If you enter a caloric deficit, your body burns stored fat. How can a clinician guarantee that fat injected into the labia will permanently survive the body's natural metabolic processes?
That's a great question. And the term permanent here requires a deep understanding of cellular behavior. The injected fat does not become immune to the metabolism.
Okay.
In fact, the immediate hurdle is just surviving the transplant itself. When fat is harvested and re-injected, it's temporarily cut off from a blood supply.
It's flying blind.
Exactly. So surgeons actually anticipate a massive die-off. They expect a 30% to 50% reabsorption rate within the first 3 to 6 months.
Wow. So half of the transferred cells essentially starve before they can take root.
Pretty much. And to counteract this, surgeons employ a technique of deliberate overcorrection.
You overfill it.
They inject significantly more fat than is aesthetically required, knowing a large volume is going to vanish. The permanence relies entirely on the cells that survive past that 6-month window.
Because those resilient cells stimulate angiogenesis, right? The creation of new blood vessels. They hook into the local plumbing.
Right. And once they establish that vascular connection, they integrate fully into the surrounding tissue. They will behave exactly like any other fat cell on your body.
Meaning if the patient gains weight, the labial fat cells will expand.
And if they lose a significant amount of weight, the volume there will decrease. It's living dynamic tissue. It's not a static silicone implant.
And that biological integration offers something synthetic fillers just can't. Our sources place heavy emphasis on the stromal vascular fraction within the transferred fat.
Yes, that's a huge selling point.
Because this fraction is a potent mix of mesenchymal stem cells, endothelial cells, and growth factors. So the mechanism here goes beyond simply inflating the tissue.
Right. It actively stimulates the underlying structures to regenerate collagen and restore elasticity to that atrophied skin.
It represents true tissue regeneration. But obtaining that biological benefit requires navigating a grueling recovery process, one that heavily contradicts the casual lunchtime tweak marketing we talked about.
Oh, totally. If surgeons are deliberately overfilling the area with fat to account for cell death, the immediate visual aftermath for the patient must be, well, alarming.
Highly distorted.
Yeah, the tissue is going to look highly distorted, swollen, and very bruised from the trauma of multiple injections.
So the clinic strongly advised patients that immense patience is required. Let's look at the downtime. With the HA fillers, the restrictions are manageable but specific.
Right.
To allow the gel to integrate without migrating, you have to avoid any activities that put direct mechanical pressure on the area for about 5 days.
So no cycling, no horseback riding.
No sexual intercourse, and no tight compression garments.
But the surge fat transfer, that is a completely different reality. You're recovering from 2 distinct surgical sites.
Oh, right, the donor site too.
Yeah. The liposuction donor site requires the patient to wear restrictive compression garments around their abdomen or thighs for 6 weeks.
6 weeks.
Just to manage swelling and ensure smooth healing. And for the grafting site at the labia, the protocol is severe. No showering at all for the first 48 hours to prevent infection at the entry points.
Wow.
Furthermore, patients are instructed to avoid tampons, submerged baths, and any strenuous physical exercise for up to 6 weeks.
I mean, if you're listening to this and wondering about the daily logistics, just consider the biomechanics of simple, unavoidable human functions.
Sitting down.
Yes. The intimate location of this procedure means basic actions like sitting down at a desk, walking up a flight of stairs, or even just using the bathroom. They're going to be distinctly uncomfortable, if not outright painful, for days or weeks.
You're navigating daily life with an engorged, traumatized pelvic region.
Right. And the sheer complexity of the anatomy involved, combined with the intensity of the recovery, makes the regulatory landscape surrounding these procedures incredibly alarming.
That's where things get really concerning, because if you look at the NHS commissioning guidelines, specifically the BEST guidelines, they are unambiguous.
Very strict.
The public health system does not routinely fund procedures aimed solely at improving outward appearance. They categorize everything from tattoo removal to cosmetic labiaplasty as strictly private matters.
Barring exceptional medical circumstances, of course.
Right. But this policy essentially forces patients entirely into the private aesthetic sector, which currently operates with a terrifying lack of stringent medical oversight.
It's the Wild West. We've normalized cosmetic injectables to the point where beauticians offer them at local hair salons alongside blowouts and manicures.
Which is wild.
To understand the extreme danger of this normalization, the Telegraph report highlights a really harrowing cautionary tale via the consumer safety group Save Face.
Yeah, the story about the woman named Busby.
Right, it details her experience. She paid £180 for a routine lip filler from what appeared to be a professional high street salon.
But the untrained beautician made a millimeter error in needle placement, and they injected the dense hyaluronic acid gel directly into a blood vessel.
The result was a severe vascular occlusion. The gel acted as a literal plug, completely blocking blood flow.
Awful.
Busby had to seek out a Save Face accredited medical nurse and pay £1,500 to undergo excruciating treatments to dissolve the botched filler. And the nurse informed her that she narrowly escaped permanent blindness.
And, to understand how a lip injection causes blindness, you have to look at the interconnected vascular network of the face.
It's all connected.
Right. If filler is injected under high pressure into an artery around the mouth, the retrograde flow can actually push that gel backward up the arterial network.
Just reversing the flow.
Exactly, eventually traveling into the ophthalmic artery. And once that artery is plugged, the retina is starved of oxygen and blindness occurs in minutes.
It's terrifying.
Yeah.
So if a 180-pound lip filler carries the risk of retrograde arterial blockage and blindness, think about the implications of letting an untrained practitioner inject fillers into the labia.
The risks are devastating.
The vulva is not just a flap of skin. It is a highly complex, densely vascularized hub of nerve endings and major blood vessels, like the pudendal artery.
Right. An occlusion in the labial vascular network doesn't just result in an asymmetrical aesthetic result. By starving the genital tissue of its blood supply, an untrained practitioner risks triggering widespread tissue necrosis.
Necrosis, so the tissue literally begins to die and rot.
Yes. But beyond the mechanical dangers of the needle itself, Dr. Victoria Manning, a clinical director cited in the Save Face report, she identifies an even more insidious risk.
Well, this part was chilling.
Yeah, the greatest danger of an unregulated beautician isn't necessarily what they inject into the body, but what they fail to recognize before they even push the plunger.
Because beauticians possess no diagnostic medical training.
Exactly. Dr. Manning shared a case file of a patient who sought out a labial volumization treatment. The patient believed she simply had deflated tissue causing chronic discomfort.
Just age-related thinning.
That's what she thought. But because Dr. Manning is a trained physician, her pre-treatment examination revealed a severe underlying pathology. The patient actually had marked vulval lichen sclerosis.
Which is an autoimmune condition, right?
Right, it causes extreme scarring. But alongside that, there was a potentially underlying vulval malignancy.
Cancer. The tissue wasn't just aging, it was diseased.
Yes. The patient was immediately diverted from aesthetic treatment and referred to an oncology specialist.
Thank goodness.
But think about it. Had that woman walked into a high street salon for a discounted labial puff, a beautician would have confidently injected hyaluronic acid directly over a malignancy.
They would have literally masked a life-threatening cancer diagnosis with cosmetic filler.
Which is just a chilling realization.
It really is. When altering this specific anatomy, a practitioner is not simply painting a canvas. They are interacting with a complex biological system that requires a verified medical diagnosis before any aesthetic intervention takes place.
Absolutely.
So, to distill the journey of our sources today for you, the labial puff treatment represents a highly targeted response to the biological collapse of the labia majora's cellular scaffolding. Women are navigating this intense friction between a genuine need for functional, physical relief and the heavy, modern pressures of curated aesthetic standards.
Right.
They're weighing temporary, antioxidant-shielded HA fillers against the grueling recovery of permanent, regenerative fat grafting. Yet, while the industry markets these treatments as casual lunchtime tweaks, the intricate vascular anatomy and the severe risks of botched backstreet procedures, they demand absolute, verified medical expertise.
We are witnessing a perfect storm here, where advancing regenerative technology collides with shifting cultural beauty standards.
Yeah.
And it leaves us with a really profound concept to evaluate. We've completely normalized altering our facial features with injectables, treating them as just routine maintenance.
Like getting a haircut.
Right. But as these cosmetic procedures migrate from our public-facing identity to the most intimate, hidden parts of our anatomy, it forces a question about the future of human body modification.
What's the logical endpoint?
Exactly. Will we eventually view our entire physical form inside and out, visible and hidden, as nothing more than a fully customizable, infinitely adjustable avatar?
A completely modular body. It's definitely something to think about. That's all for today's deep dive. Thanks for listening, and we'll catch you next time.